Every year in America, 30 to 45 million young people ages 6 to 18 participate in organized team sports. 20 to 25% of these athletes will suffer at least one concussion during their season.
And it just felt like a vibration. I just slammed my head on the ground. It was just like a pound. We shook hands with the other team and I don't remember any of it.
So be here and then like go up like that. We were in guard practice and I hit myself in the head with a rifle. I was really dizzy and I passed out for a couple minutes.
You know, 3-day camp, we practiced 3 times a day. After the second practice, I think, I went back to lay in my bed later that day in the dorm room and I just the room was just spinning. And I was like, that's not right.
So just what is a concussion? How do you recognize the symptoms? And how should you respond to a suspected concussion? Hi, I'm Dr. Catherine Brumand, clinical neuropsychologist. Sports-related concussions are more common than we used to think. They are invisible injuries, meaning that most of the time others have no idea how the injured person's being affected. They are essentially the same as any other concussion, but with sports-related concussions, there's a danger in returning to play too soon and getting another injury that could lead to a more severe brain trauma. When the brain is jolted, it bounces around inside the skull. The soft tissue of the brain can be injured by the hard boniness of the skull. The soft brain tissue also rotates, it stretches, and layers move over other layers, causing additional damage. On top of all of this, there are chemical changes that occur. You don't have to be knocked out to have had a concussion. In fact, only 10% of concussions include a loss of consciousness. The most common symptom after a concussion is headache, but dizziness, nausea, vomiting, balance problems, trouble sleeping, irritability, concentration problems, and memory problems are all potential symptoms. You may have only one symptom, or you may have many symptoms, but any symptom is significant and should be evaluated by a doctor.
It was really slow, like it took me time to process. Like I was still getting things done, but it was hard to take in information.
I was really tired and I was dizzy and it was like hard to walk straight kind of thing.
I noticed that my personality changed a lot. I was very irritable with the people I wasn't irritable with in the beginning. I was very mean, I guess you could say.
All concussion symptoms should be evaluated and treated by a healthcare provider who's familiar with concussion. Kaiser Permanente doctors have been trained in the diagnosis and management of sports-related concussion. Here in the North Valley, we also have a program called the Sports Concussion Program, where doctors may choose to send their patients for additional evaluation and treatment.
So the test is going to be broken down into 5 different parts. When you go in to take the test, it's going to be...
Using a computerized exam, we're able to establish an athlete's preseason baseline, which tests their cognitive ability. This 20-minute test measures information such as reaction time, processing speed, and memory. Athletes take the test prior to the season, and then if we think that they have a head injury during the season, we retest them to determine when their hip brain is healed.
Well, beautiful thing about the Kaiser plan is it allows every athlete to be baseline tested. So before they even take the field, we know where they're operating on normally.
Before my concussion, it was a baseline test, was 79th percentile. And after the concussion, my first visit with Dr. Brumand, I was in the 7th percentile for reaction time.
It gives us that number, that benchmark. We know where that kid is supposed to be, and if they're injured, we now have something to refer to let us know when it's healthy for them to return to the field.
In addition to the cognitive and medical evaluation, Kaiser Permanente also uses an individual care plan to make recommendations for school accommodations. Parents are encouraged to take these plans and discuss them with the school staff.
Her prescription was basically he needs to not do any testing, not do any homework, and really focus on giving his brain some rest. Just like you would if you had a sprained ankle or injured knee. You don't want to use that. Well, you can't stop using your brain. You can't turn it off. So we did that by minimizing how much schoolwork he was doing and all of the other distractions.
And it was nice to know that I had, someone helping me progress in a test and something that reassured that I was actually progressing and not just me, oh yeah, I feel like I'm getting better, just the actual facts, everything right there that I am getting better.
Advocating for your child at school and with their coaches is important. At home, keep the house quiet. Don't expect chores to be completed, and remind your child to avoid activities like texting, using the computer, and playing video games unless the doctor has said those activities are okay. Every concussion is different, and every athlete recovers at their own pace. However, studies have shown that most children and teenagers recover within about 3 weeks. About 20% will take longer than that. Your child should return to play only when they have a normal office evaluation, have completed the gradual return to play protocol, and have received written clearance by a medical provider. In most cases, people who experience a single uncomplicated concussion will recover completely. However, after multiple concussions, 3 or more, some will go on to develop chronic problems such as memory, attention, and behavioral changes that never fully resolve. While concussions are not preventable, Kaiser Permanente is on the leading edge of monitoring, evaluation, and the treating of sports-related concussions. Ask your child's doctor about signing up for baseline testing.
In our case, we were very fortunate because Kaiser Permanente does have a concussion program. So we got specialized treatment and care seen by a specialist who could tell us exactly what to expect. They'd tell us exactly what the symptoms were, tell us exactly what the prescription was going to be to make him healthy again.